This is Majak Radio.
Every day, people walk past us, some with a smile, some with a side behind the ordinary. There are stories that stay quiet, waiting for a moment to be heard. Good morning, wonderful listeners, and welcome to your weekly program, The Unspoken, live on Majak Radio 92.2 FM in Bakau, Newtown. I am your host, Fatou Sanyang. Today, we are diving into a topic that touches many lives, though we don't always talk about it: infertility. Whether you are planning a family or just curious, stick around as we unpack the hidden causes of infertility. Our special guest for today is none other than Mr. Abdul Pane, a fertility specialist and a senior midwife at Ahmadiyya Hospital. He is also a nursing and midwifery lecturer at the Hadigala International College. Mr. Pane has been treating patients with infertility, turning whisper into hopeful beginning. Mr. Pane, welcome to The Unspoken.
Thank you.
Now to begin the conversation with Mr. Pane, we are diving in. Stay with us, there's more to uncover. Mr. Pane.
Yes, please.
To begin the conversation with, when we say infertility, what does infertility mean itself?
Thank you, Fatou, for having me into your program, this weekly program of The Unspoken. I am honored to be part of you guys. Actually, infertility is one part that is rarely spoken about, and it has a lot of misconceptions out there in societies, which maybe we will discuss later on.
Yeah.
But in simple terms, in plain and simple terms, infertility means when a couple is struggling to get pregnant for 12 months of unprotected sex without the use of contraception, or a couple that is struggling to carry a pregnancy to term. When I say a carry a pregnancy to term, it means a couple struggling to carry a pregnancy to 9 months and deliver a baby. So that is what infertility means. Mm-hmm. Meaning couples, I'm saying couples, I'm not saying a woman. Yeah. Because both the man and the woman gets pregnant in our own understanding. That's what we take it to be. So when a couple is having unprotected sex without the use of family planning or contraception for a complete 12 months and there is no conception, no pregnancy, we say there is infertility.
Thank you.
Thank you. In simple terms.
Yeah. Now to the main topic itself. As a fertility specialist, when we talk about infertility in couples, what are the main causes that often hide behind the background?
Okay. Thank you, Fatou. Before I come to this second question, which is very important, and as you said, is the essence of the discussion for today, I also want to throw more light on the prevalence, the magnitude of the problem, because that is what it's talking about. Yeah. Infertility is a serious problem, not only for the Gambia,
exactly,
and not only for Africa, but it's a global problem.
Yeah.
Globally, about 15% of couples are struggling or battling with the problem of infertility in one way or the other. There are different types though, but then about 15%. If you come to the Gambia, about 14.3% of couples are struggling with this problem. So 14.3% is almost 15%. So the Gambia is almost leveling up with the global statistics. So infertility is a serious problem. Out of that, 50% of all infertilities are due to the woman, and 40% are due to the man, and the remaining 10 is a problem for both, wherein a couple, both man and woman, having a problem. So it's a serious problem and it needs to be dealt with. Coming to your question, the main causes of infertility, I want to just give a preamble before I go into the main causes of infertility. The preamble is that for fertility to take place, for a woman to conceive, for a man to be able to make a woman pregnant, there are prerequisites, there are requirements. There are things that must be in place for a woman to get pregnant. First, the woman must be within the normal age. We have an age bracket. We normally call it reproductive age. Secondly, the woman should be able to produce good eggs. When I say good eggs, I am talking about the number should be good, and then also the viability. The eggs should be healthy eggs. That is very important. And then still now on the woman should be able to see her menstruation every month, because menstruation brings about the release of an egg, which we call ovulation, without which there cannot be any pregnancy. And the next thing is that the woman also must have very good structures. The tubes through which the eggs must travel should be patent. There should be no blockage, and there should be no obstruction. There should be no narrowing as well. So there should be patency of the tubes, and the womb, we normally refer to as the uterus, the womb, where the baby should be lying down for the next 9 months, also have to be healthy. No abnormalities like tumors, no fibroids, and some of the other problems. All these things put together, the woman also should have proper hormones. The brain should be functioning properly, and all the other hormonal things should also be functioning properly. If that happens, then there will be fertility. Now, that takes me to the main causes of infertility for a woman. Number 1 is the issue of ovulation disorders. Ovulation, as I said earlier, is the release of an egg. So any woman that is not ovulating, that is not releasing eggs, cannot get pregnant. So one of the causes is ovulation problems. The second cause, and that is very common in the Gambia, is the issue of infections, genital infections. And when we say infections, it is very broad. You know, STIs in general could lead to problems of infertility. Syphilis, chlamydia, gonorrhea, and there is one serious problem in my own studies and in my own experience as a fertility specialist. I realized that about 55 to 60% of Gambian women that I have come across with, most of them, their problem is what we call PID, which is a form of infection, pelvic inflammatory disease.
So that is the causes that you've just mentioned. Is it more prone to women than men?
Yeah. I'm trying to break it down. I'm currently talking about the problems of the woman.
Okay.
Then I will talk about the problems of the man.
Yeah.
Okay. So the problem of the woman, as I said, ovulation, that is number 1. The second problem is hormonal imbalances. So there are hormones. Generally in a woman, we have hormones that regulate our body. We have hormones that controls everything that we are doing. So there are 3 organs that actually control the hormones that are responsible for reproduction in a woman. One of those is the thyroid, the T3 and T4, the thyroid gland. The second one is the brain itself. We have a portion of the brain we call the pituitary, anterior pituitary gland. And the third one is the ovaries. All these, they produce hormones, and these hormones, they contribute to fertility. So if they are imbalances, too much or too less, then it could also lead to problems of infertility. Another problem of infertility in women is structural abnormalities, as I stated earlier. If there are any tumors, any fibroids, any narrowing, and all those stuff, it can also lead to the problems of infertility, together with the infections. Yeah. Basically, that is for the woman.
You are still tuned into the Unspoken, the place where whispers becomes word. We just heard some powerful raw voices from our community, real stories that remind us why we are here. Mr. Pane, how will you react to what you've just heard?
Okay. Fatou, I think that is a common phenomenon with regards to our society.
Exactly.
Most people have that misconception, and that's what I told you earlier on when we began the discussion. Most people are having this misconception that women are the problem when it comes to infertility. I always want to say this, and I tell my students all the time, my colleagues that I work with, and also my patients, that infertility is not a woman problem. It is also not a man problem. It's a couple's problem.
Exactly.
So it's a problem of the woman, it's a problem of the man, and it's a problem of both of them. So therefore, we don't call it a man's problem, we don't call it a woman's problem, but we call it a couple's problem. As I stated earlier, the statistics, 50% of them are women problem, 40% are men problem. And here, I want to give you live examples. Maybe I will just give you 2 examples why this is a very serious misconception. I have had a couple, currently I'm treating a couple, currently. And this particular couple, they have been married for 9 years now. 9 years in a row. And the woman has not even had a miscarriage before. No conception, no pregnancy whatsoever. So the only thing that the man believes that he is fine. So the only thing
that's what they always,
that's always the concept.
Yeah,
yes,
blame
exactly
is always on women.
So yes, the man believes that he is fine. The family believes that the problem is the woman. again, the family problem, societal problem. So the only thing that man does is provide money for the woman to start jumping from one marabout to the other, go to Casamance, come back, go to Senegal and come back, and he will be sitting down at home and waiting for the treatment to be effective. Doing everything, they realize that things are not going the right direction, and somehow someone directed to come to my place. So they came to Ahmadiyya Muslim Hospital. I had a discussion with them in detail, because that's what I always start with, the history. Because 85% of answers are usually in their story. So you listen to them and then you understand. So when I did a test, I realized that the woman is perfectly fine. Yes, structurally the woman's organs are all okay. No infection, no serious infection that could cause problems of infertility, and the hormones are all within the balance. They're all fine. But I realized that the man is having a problem with hormones. The woman is having low hormones. In short, the man was the problem. But he didn't know about it. In fact, the man had a problem that will even need surgery, which we call varicocele. So we had to operate the man, and then currently I'm giving him medications, and hopefully we will get some results by the grace of God.
Interesting.
So that is just an example that is happening right now at my desk. So we have those kind of problems, a lot of them happening. So it's not a man problem, it's not a woman problem, it's a couple's problem.
Exactly.
So it should not be linked to the woman at all.
Just tune in, you're listening to the Unspoken on Majak Radio 92.2 FM in Bakau, Newtown. And to be part of this discussion, you can call or text on 3312655. 3312655. Mr. Pan, I think we have a caller.
Okay.
Hello, caller.
This is Carissa.
Welcome to the Unspoken, Kadi.
Okay, my question is, what are the different types of fertility treatment available?
Mr. Pan, that's a question for you.
What? I don't hear the question properly.
She said,
Thank you.
what are the different fertility treatment? Something like that.
Did you say treatment or types?
Types. Sorry.
Types of infertility.
Yeah.
Oh, okay. Okay. Thank you very much, caller. Kadi, right?
Yeah.
Yeah. Thank you very much for the question. Actually, that's a very important question. Infertility can be broadly categorized into two main types. We have primary infertility and we have secondary infertility. Primary infertility is when the couple have never had a conception before. A woman that has never been pregnant before, no miscarriage, no pregnancy carried to term. In short, we say that one is primary infertility. And the second type is secondary infertility. Sometimes it happens in society. You will see a woman that is pregnant, have a child, 2 or 3, and then from there on they have a standstill. We have that kind of problem. Some women will have 2 kids at home, and then they are standing, no child again, 5 years, 7 years down the line. We refer to those as secondary infertilities. So they've been fertile before. For some reasons now they are no more having pregnancies. And then still under that secondary infertility, we have some that they have recurrent miscarriages. Get pregnant 1 month, miscarry. Get pregnant 2 months, miscarry, continuously. They cannot carry pregnancy to term, so we also refer to those ones as secondary infertility. So basically that's secondary, and primary is when you never had a child before. So those are the two main types. Yeah.
We have another caller.
Yes.
Hello.
Yes, good morning. Tijan S. from Majak.
Welcome to the Unspoken, Tijan.
Thank you so much. I have 2 questions for the guy.
Okay, go on.
I want to know why is it women when people hear infertility? And the other question is, does tight clothing causes infertility? Thank you.
Thank you.
Okay. that's a very interesting question from Tijan, right?
Yeah, Tijan.
Well, I will start with the first one. Why always women? That's what he said, I think. I think we've already talked about that earlier. Just to throw more light, generally speaking, people always label women to be the problem when it comes to infertility. Maybe because they are the ones that does most of the job. Most of us men, we We after the impregnation, we only provide feeding. Maybe they carry the pregnancy to 9 months and all that stuff. But generally speaking, actually, it's not a man problem, it's not a woman problem. As I said it earlier, it's a couple's problem. So it's a misconcept that people always talk about a woman, and these are serious problems that are happening. And I will give another quick example there before I move on to the second question that he asked about tight clothing. I also have a couple. Actually, it's not even a couple, but the woman was the one that came because the husband felt he's perfectly fine. So there's no problem with the husband. So he only provided money. So the wife came because they went to many places. So the wife came to me and then explained the problems to me. So I'm not trying to discourage the issue of polygamy. Let me state that right away. Okay. But this woman was married into a polygamous family. The husband was having already 3 wives and he is the 4th wife. So the man, I know the tribe, but I don't want to stereotype. So the man is having money. He has money and he has 4 compounds. Each wife is in your own compound. So he goes turn by turn, 1 week for every wife. Unfortunately, the week that he normally comes to this new wife is not the week that the wife is fertile. It's not in her fertile window. So she cannot get pregnant within that period. So he's always coming to the wife, but no pregnancy. And then 2-3 years down the line, this couple, with this person particularly, I asked about the history, and when he explained everything, I tracked her ovulation date to know when she normally releases an egg so that I can know her cycle. Then I called the husband and explained to the husband, could you believe I did not give them any treatment, no medication. The only thing that we did was to change their schedule for them. Let's reshuffle the schedule again. When the schedule was reshuffled, 2 months down the line, she got pregnant. So that was about scheduling problem only. So tight clothing, yes, they have an effect, especially in men. Tijan asked the second question, especially in men that put on tight pants and nylon pants. We always advise to have loose panties and cotton panties, because if they are tight, they cause overheating, and if there is overheating, it affects sperm production, and that can also lead to infertility down the line. So yes, it can cause a problem. So we advise otherwise.
You see, this is why the Unspoken is here. These are some of the things that people hardly talk about.
Yes, exactly.
And it is affecting.
It's a serious problem.
Exactly.
Yes, especially this, how do I call it again? These tight men boxers. How do you call it?
Exactly.
Sometimes it's a serious problem. And women in general also, they have these tights. They have these things that they normally put on and all those stuff. So it's better to have something that is loose, and if you put on something that is not loose, let it at least be cotton. So we try to avoid nylons and we try to avoid tight pants and all the stuff also.
Now to our question.
Yeah. Our question was like, what was it again?
She said genuine medicines that can cure infertility.
Infection or infertility?
Infection rather.
He said infection.
Infection that can lead to infertility.
Okay.
Yeah.
Yes, actually, yes, we have genuine. I will not use genuine. I will use effective. Normally, we use the term effective with us in medical field. We have medications that can treat infection, but to be honest with you, this area of infertility is a special area. It doesn't necessarily mean that you are a doctor, or you are a nurse, or you are a midwife, so you have the technical know-how on how to deal with infertilities. No. It's a special area and people do specialize in them. So many people are treating infections for infertility in a wrong way. And if it is halfway treated, it can even lead to a more serious problem. So yes, we have medications and the medications are effective. The only thing you need to do is to make sure you do the investigations, know the exact problem and treat the problem. So yeah, we have those things.
We have another text message.
Yes.
And it says, "Hi, this is our Bob. This is an educative program. I have a question for Mr. Abdul. What do you think can remedy the misconception of infertility in our society?"
Well, thank you, our Bob. I think I would say it's a lot of work to do in order to remedy this misconception. But I'm proud to say that Majak have already started it, because the most important part in trying to remedy this problem is sensitization. People should know, and people should be empowered with education. People should be educated. Informing people means empowering them. So if people are informed and they know, then obviously they will come early for medications, they will come early for investigation or consultations, and they can be able to get treated on time. So for me, the most important thing is the sensitization part, massive sensitization like the way you're doing, and individual sensitization when we come in contact with couples and individuals that are having problems with fertility. And perhaps they can also take that back home to their families and disseminate the information. Yeah.
Fascinating. Sometimes there is nothing medically wrong. The misery remains. How do you handle such cases?
Okay. Yes, we normally have those kind of cases. In one of the callers asked a question about the types of infertility. So I said we have primary and secondary. I said it can be divided mainly into two main categories. When sometimes science is stuck, sometimes science, you don't have an explanation to certain things. In medical terms, we call that idiopathic. In our own medical terms, we call that idiopathic. It doesn't only affect infertility, but it affects almost everywhere.
The line is
I can see that. I can see that. It's an interesting topic anyway.
Hello, caller.
Yes. Good morning.
Morning. Welcome to the Unspoken.
Thank you. I am Ibrahim by calling from Bakau.
Oh, Ibrahim, welcome.
Yeah, so, of course, I must comment, you and the guests for a very timely and interesting program.
Thank you.
The issue of infertility, has ended so many marriages.
Exactly.
It has, caused family troubles, ended long-standing family relationships. So, to Amadou and to the guests themselves, I'm an expert in the area, or I'm a specialist in this area. I want to know, is it that the issue of infertility is one-sided, or it could be both at the same time? And if it is one-sided or both at the same time, what mechanism could be, put in place to ensure that fertility is regained? Thank you.
Thank you, Ibrahim.
Okay. All right, that's fine. Thank you, Ibrahima, for that question. I think the callers are just overwhelming this way.
Exactly.
Well, I just want to complete what I started earlier, so that there can be that connection.
Exactly.
You asked about those who are medically sound, medically okay, and what do we normally do for them? It happens sometimes, and that type of infertility is what we call unexplained infertility. That is plain English language. It is a type of infertility that we have no explanation to. It's unexplained. Medically, the woman is fine. Medically, the man is fine. So usually, we advise them on certain things. Number one is we counsel them. Most of the time, some of them, they are just apprehensive in haste. They are in haste. So we normally counsel them and we advise them to keep up with some lifestyle modification, lifestyle changes. We advise them to also maintain a healthy lifestyle. If they were smokers, we ask them to stop smoking, not to drink alcohol, try to maintain body fitness, and also maintain a normal weight for their height, which is very, very important. And then we also discuss with them about timing of sexual intercourse. We talk to them about their ovulation period, tell them about the fertile window, and advise them when they reach the fertile window. I always tell my students that when a woman reaches the fertile window and wants to get pregnant, they should not burn the midnight candle. They should burn the 3 a.m. candle. There is a difference between 3 a.m. and midnight. That means they should not sleep, actually. Yes, so that is what we do. And then also, later on, if that did not work, after 1 year plus, we also introduce to them about technology, fertility technologies, because we have fertility technology that can assist people to get pregnant now. So, like artificial insemination, IVF, in vitro fertilization, XC, ICSI, and so many others that are a little bit complex. They can be done, and that can also help them to get fertile as well. Yeah, please.
Interesting.
Yeah.
And to Ibrahim's question.
Yeah, Ibrahima asked about is it one-sided or both-sided? Yeah, I think that is something that we cannot overemphasize. That fertility is not one-sided. In fact, some researchers will tell you that it's almost 50-50. I told you here that 50% woman, 40% man, and 10% both. That 10% both, if you add that percentage again to the 40, you are almost coming to 50-50.
Yeah.
So it's not a woman's problem. So people trying to sideline women and then stigmatize them in the society, they face a lot of problems. Some even get divorced And sometimes people get divorced because of a misconcept, and they find it even hard to get another man to marry them. We have seen all those kind of problems in society. So it's not a one-sided problem. As I said, it's a problem that can affect both. And another thing that I want to just add on to that one is, sometimes a woman will have a child before in life, previously, and now you believe that, oh, okay, I am okay now, I'm perfectly fine. So why am I not getting pregnant? I'm not infertile. Infertility might, catch up with you. You might start to have a child, and then later on you develop it. It's not a cause. It's not a punishment from God. It is just a disease condition, like any other disease condition. So it can affect any woman or man at any stage of your life. So if it happens, you have to just accept that it has happened, and you go and seek treatment. And basically, that is it all about it.
That is it.
Yes, please. Thank you.
Another question.
Yes, please.
How important is early diagnosis?
Okay, very, very important question, Fatou. Early diagnosis in infertility is very important because, one, when there are so many options in infertility treatment, but then those options, you're only open or opportune to them when you have early diagnosis. So if couples come for consultation and they are given diagnosis very early, then they can be given different options to choose from the list of options. But at some point in time, when you're late to come, you have only a few options to choose from, because all the other options might have faded away or they will not be effective when they are used. So that is number one importance. That is, it will avail the couples to have a lot of options to choose from with regard to treatment option. That's number one. Number two, it will also provide counseling. It also provides the services of counseling, and it helps to relieve emotional stress and even financial stress. Trust me, if you have early diagnosis, it will help you to save a lot of money than when you wait until it is late. So many aggressive investigations, so many detailed investigations that are very expensive at times will only be done when the woman or the man comes late. So when you come early, it can be detected very early, and then problems can be solved at that stage before even it gets complicated or it gets out of hand. That's why it's very, very important to also come early. And when a woman also comes early, then you have early diagnosis. So if couples come for consultation and they are given diagnosis very early, then they can be given different options to choose from the list of options. But it will help them to have various options. It helps to prevent complications from developing, and it increases or improves the chances of getting pregnant. It improves their chance of getting pregnant. So early diagnosis means early treatment. Early treatment means improved chance.
The discussion is really interesting, but we don't have much time.
Thank you.
Before I let go, what's that one piece of advice you wish every couple knew before they start the journey?
Wow. Okay. All right. Thank you very much, Fatou. Actually, I don't know if I can change it from one piece of advice to two pieces of advice.
No problem.
If you will indulge me.
Yeah.
Actually, that one thing, number one, that I would want to always emphasize, we've already talked about it throughout, that is society, individuals, couples, and families should understand that infertility is not a problem of the woman. That is number one problem.
Very important.
People should, yes, it's very important, very, very important, in fact. People should understand that infertility is a problem of the couple, not the man, not the woman. It can affect any man, it can affect any woman at whatever stage of their life. And this is very, very important. And then the second part is in this era. Now I always want to tell my staff and my colleagues and students that women nowadays, they want to smell good and taste good. The language I'm speaking. They want to smell good and taste good. So what I'm talking about is these products. So now if you go to TikTok, for instance, you go to WhatsApp status, TikTok, Facebook, Instagram, everyone is selling products. Products for women, this one is very effective, and they will be telling you, my product have no side effect. You hear about that a lot.
Exactly.
That is not true. There is no, for us in medicine, we believe that every drug is potentially harmful. Even paracetamol, the simple paracetamol, can cause liver problem. So you cannot give me a product and you say it works very fine in 2 weeks. They will tell you 2 weeks effective. And in that 2 weeks, it cannot do anything to your body. You know, logically, it does not even make sense.
Yeah.
So some of these products that we are using, they are very serious. Why? The products that we use to cleanse ourselves, the women, especially the women, to cleanse ourselves, detergent and some of the other things that makes us smell good, taste good or whatsoever, they normally destroy what we call the normal flora. Every woman has an acid inside of them, and that acid we call the lactic acid. That acid helps to prevent infections from climbing in. And when you use a lot of these products, it can destroy that acid and will leave the woman open. Can lead to infections. The infection can ascend up and it can affect some of the other structures and organs, leading to infertility later on in life. So I just want to advise my sisters out there that they should be very careful with the products that they use. So those products, especially the strong ones and those that are heavily scented, we should avoid them and try to keep it clean. That also causes a lot of problems as well. Yeah.
Thank you, Mr. Pane, for shedding light on these silence factors. That brings us to the end of today's episode of The Unspoken. We had the whispers, the questions, and the hope. We hope the silence has been a little louder for you. Remember, your stories matters. Keep sharing, keep listening. I've been your host, Fatou Sanyang. Join us next week as we continue to give voice to the unspoken. Until then, stay curious, stay compassionate. Bye.
This is Majak Radio.